To begin with, this slide shows poor morphology of the muscle biopsy, and the staining is not clear. Whereas this slide shows a stained muscle sample with good freeze morphology. The membrane staining is sharp and clear. The muscle biopsy freeze protocol is in the Investigator Laboratory Manual. Make sure that the following reagents and materials are present before the start of the procedure. Wear surgical gloves during biopsy freezing procedure and when handling the frozen cryovial. Attach the label to the aluminium cryovial and add sticky tape. Pre-cool the opened cryovial and lid by placing on dry ice for at least 5 minutes prior to the collection of the muscle biopsy. The cryovial should also be kept on dry ice during the whole procedure. Pre-cool all tweezers and forceps on dry ice, making sure the tips are cooled. Always have a filled liquid nitrogen tank ready on the desktop next to the dry ice box. Finally, measure 45 ml of 2-methylbutane into a 50 ml tube. The muscle biopsy should be frozen within 30 minutes of excision. It should then be placed on a moist wire gauze, stopping it from drying, which may cause artifacts. Do not add extra saline or other liquid to the tissue, as this will cause tissue damage during freezing. Make sure the liquid level is still visible when placing the tube into the floater. Place the 50 ml tube in the liquid nitrogen tank. Allow 2 to 5 minutes for the 2-methylbutane to chill until there is no more vapour. Use the pre-cooled small, smooth forceps. Pick up the tissue edges to avoid damage. If the sample has become curled, you can remedy this between gloved thumb and forefinger, using the minimum handling possible. Be careful not to squeeze the tissue. Freeze the muscle biopsy in a straight, longitudinal orientation. Freeze the biopsy by immersing the forceps for 10 to 30 seconds in the cold 2-methylbutane. Do not drop the muscle biopsy into the tube. Simply hold the edges using the smooth forceps. Immersion time depends on the size of the muscle biopsy. It is critical to avoid having any droplets of 2-methylbutane attached to the muscle biopsy. When transferring it to the cryovial, gently wipe off excess droplets on the edge of the tube. Transfer the frozen muscle biopsy, still held by the same forceps, to the pre-cooled cryovial on dry ice. Screw on the cryovial lid securely without removing the cryovial from the dry ice. It is important to completely cover the cryovial with plenty of dry ice. Transfer the cryovial on dry ice to a -70 or -80 degrees C freezer and store frozen until the sample is shipped. When you prepare samples for shipment, wear surgical gloves. Have the transport box filled with dry ice ready next to the freezer. Open the freezer and put the cryovials directly on the dry ice. Top up the box completely with dry ice and finally seal the box. Avoid unnecessary contact and handling of the cryovial to minimize the risk of defrosting. Always wear gloves when handling frozen cryovials. The 2-methylbutane can potentially start to freeze within 5 to 10 minutes, so keep the biopsy close to the freezing location before floater and tube are placed into the liquid nitrogen. If the 2-methylbutane is partially frozen, remove from the liquid nitrogen, defrost, and repeat the procedure before freezing. Immediately, pour out most of the 2-methylbutane into an empty 50 ml tube and tap off the remaining 2-methylbutane containing the muscle biopsy into a Petri dish. Take out the muscle biopsy using smooth tweezers or forceps. Gently wipe off all excess 2-methylbutane along the edge of the Petri dish and place the muscle biopsy in the pre-cooled aluminium cryovial. Please note, it is important to make sure the muscle biopsy remains frozen. Take the pre-cooled large tweezers and take out the muscle biopsy as soon as possible. The large forceps should be pre-cooled to reduce vapor production when submerging into the liquid nitrogen. This will make it easier to see the sample clearly when trying to retrieve the muscle biopsy from the liquid nitrogen. Wipe off all excess liquid nitrogen and place the muscle biopsy into the pre-cooled aluminium vial. Make a note of any additional information about the biopsy sample on the sample shipment form. Try to use the edge of the cryovial to remove the muscle biopsy from the tweezer, or use the second cooled tweezer to push off the muscle biopsy. Please do not use your hands or other tweezers to pull off the stuck muscle biopsy, as there is a chance of breaking the sample. Try to carefully soak up excess moisture with a dry gauze, without touching the tissue directly. One 50 ml tube can be used for multiple biopsies as long as they are taken on the same day. The 2-methylbutane should be discarded in the chemical waste bin.